Can you lower your arousal index? Have you ever wondered if you can actually lower your arousal index? This question is especially relevant for those dealing with sleep apnea. The arousal index is a measure of how often a person briefly wakes up or shifts to lighter sleep stages during the night. These awakenings often happen due to breathing disturbances, particularly in obstructive sleep apnea. So, how can we tackle this issue? Yes, it is possible to lower the arousal index, especially when it comes to sleep apnea. The key is to address the underlying causes of those frequent awakenings. In obstructive sleep apnea, many of these arousals occur because the brain reacts to airway obstruction by waking the person up briefly to restore normal breathing. While this is a protective mechanism, it disrupts sleep and raises the arousal index. One effective way to lower the arousal index is by treating the airway obstruction. Continuous positive airway pressure therapy is a common treatment that helps keep the airway open. This therapy reduces episodes of apnea and hypopnea, which are the main triggers for arousals. When these breathing disruptions are minimized, the arousal index typically decreases. Another approach is to increase the respiratory arousal threshold. Some individuals with obstructive sleep apnea have a low threshold, meaning they wake up easily with minor changes in breathing. Certain sedative medications can help raise this threshold, allowing the upper airway muscles more time to open the airway before an arousal occurs. This can lead to fewer awakenings and better sleep stability for some patients. Improving muscle responsiveness is also important. For sedative medications to work effectively, the upper airway muscles need to respond well and reopen the airway during sleep. If these muscles are not responsive, delaying arousal might prolong airway obstruction and worsen apnea. Behavioral and lifestyle changes can also play a role in lowering the arousal index. Weight loss, avoiding alcohol, and steering clear of sedatives that overly relax airway muscles can help reduce the severity of apnea and, in turn, decrease arousals. Positional therapy, which involves sleeping on your side instead of your back, can also be beneficial. Lastly, addressing any comorbid conditions like insomnia can help. Cognitive behavioral therapy for insomnia and improving overall sleep hygiene can reduce arousals that are not directly related to apnea events. In summary, lowering the arousal index in sleep apnea involves reducing the triggers of arousal and modifying how sensitive the brain is to these triggers. Treatments like continuous positive airway pressure therapy are essential, but for some patients, medications that raise the arousal threshold can also be helpful. A personalized approach is key, as the effectiveness of these strategies can vary based on individual characteristics.